Go ahead, Claire.
Okay, hello everybody, and welcome to our conversation with Claire today. Thank you everybody for coming. It's amazing the number of people who registered for today and that are actually already online, so welcome. And welcome back to week 2 of the Canadian Nurses Association Coffee with Claire webinar series. And for those of you who are joining us this week and were unable to be there last week, my name is Claire Betker, and I am the president of the Canadian Nurses Association, and I'm a longstanding registered nurse from Winnipeg, Manitoba. We initiated this series last week, this webinar series, to give you, our members, but also to give the Canadian Nurses Association, our officers, our board of directors, our staff, an opportunity to connect with you, with our members, on important issues related to the COVID-19 response. So thank you so much for joining us today. And you'll see that we are going to have a conversation or a dialogue as much as the technology and the time allows us to have. I'm going to ask Elizabeth Morin right now, who's our one of our Canadian Nurses Association staff, to give us a bit of a tech overview in terms of how to use the chat box and how to use the Q&A and those kinds of things. But if you're already in there, I'd like you to start by introducing yourself, who you are, where you're from, and anything about yourself that you'd like to do. So Elizabeth, could you just give us a bit of an orientation?
Thank you, Claire. So if you hover your mouse at the bottom of your screen, the toolbar should be sliding up and you'll see some buttons. So the first button you want to click on is the Q&A button. That is the window where you're going to be posting your questions for the panelists. The second button is the chat button, and that's the one where you can introduce yourselves, make comments, provide feedback, and keep the Q&A box specifically for questions. So the Q&A is for that, and the chat is for talking with each other, talking to Claire or a specific panelist. And then we will be recording all of this, so we will be able to look at it after the fact. Back to you, Claire.
Thanks, and you can see people have found that chat box and are introducing themselves to each other. The other thing is in that chat box, we have some other staff with us. We have Josette Roussel. I'm going to ask her to speak in a moment. We have Aden with us as well she was there with us last week. She's one of our policy people at the Canadian Nurses Association. And they're going to be also posting resources. And you can also use the chat box if you'd like to share resources, things that you're finding helpful in your practice. So based on feedback from last week, and we got an enormous amount of feedback, so thank you to those who were there and did that, and some of the polling that we've done on social media, on the Canadian Nurses Association social media, we heard loud and clear that nurses want more information on personal protective equipment, and they're also wanting to anticipate and to think about and actually deal with right now some of those ethical dilemmas, those ethical decisions. I think the word last week that was used was around some moral distress. So for our conversation today, I'm really, really thrilled to be joined by Madeleine Ashcroft. She can give us a wave there, Madeleine. A long time critical care nurse and infection prevention and control expert. In fact, Madeleine is currently the Infection Prevention and Control Canada's Director of Standards and Guidelines. And she's a representative to the Canadian Network of Nursing Specialties, and she works as a regional infection prevention and control specialist in Public Health Ontario. So, and she was a former board member, and we had an incredible time together on the board of the Canadian Nurses Association. So she brings a wealth of experience, a wealth of knowledge, and a very large network of experts and expertise. So she's well positioned to be with us as an expert today. Secondly, I'm joined by Jennifer Dunsford. She also is a longstanding registered nurse here in Manitoba. and uniquely positioned right now in terms of being an ethics advisor for the Winnipeg Regional Health Authority in their COVID response. And she has been the Director of Ethics Services within Winnipeg for many years. So she is an ethics expert. And she's also, and I'm very proud of this, the president of the Association of Registered Nurses of Manitoba. Again, an incredible expert. And thank you so much, Jennifer and Madeleine, for taking time out from your very busy schedules to be with us here today. So please start to, I'm just going to do a little bit of an introduction in terms of what CNA is up to relative to these two topics. So start to ask your questions and certainly start to put what your thoughts might be into that chat box. Okay, and I'm going to ask them a question. How the format's going to go is I'm going to ask both Madeleine and then Jennifer a question, and then we're going to open it up to you who are here to ask your questions. So the discussion will be in English. However, we are joined by Josette Roussel, who is the Executive Advisor of CNA, who will be able to answer questions both in the chat box in French, but also if there's a question in French, might be able to help us with some of that interpretation. So I'm just going to ask Josette Roussel to say a couple of words before I move on.
Merci Claire et bonjour à tous les participants d'aujourd'hui. Tel que mentionné par la présidente de l'Association des infirmières et infirmiers du Canada, nous avons les deux possibilités d'avoir des questions en français et en anglais. Alors, on est à la recherche de vraiment de connaître votre expérience et ce que vous êtes inquiète au sujet du sujet d'aujourd'hui, de l'équipement de protection individuelle et des enjeux éthiques très importants pour nous. Alors, je vous encourage à mettre vos questions en français et nous allons y répondre et puis partager avec nos panélistes. Merci.
Thank you, Josette. Thank you so much. Okay, and we did have some comments, and Josette actually was active in the chat box last time answering some of those questions. So thank you. Thank you, Josette, for being here with us today. So as you know, the Canadian Nurses Association is the collective and collaborative, really the voice of Canadian nurses, both nationally across Canada, but also representing Canada's nurses in the International Council of Nurses. And as such, we have been very active advocating all levels of government to ensure that we are providing nurses with evidence-informed information and guidance and advocating for them to have appropriate supplies and equipment, appropriate personal protective equipment and supplies. And I just wanted to update you that I've had two opportunities to speak one-on-one with the Federal Health Minister, Minister Hadju, where first of all, I want to convey her message to you, her sincere thank you to all the nurses in Canada working really tirelessly right now to stop the spread of the coronavirus. I told her in our conversation earlier this week that what we're hearing from nurses across Canada, really the number one concern remains the protection and safety of nurses. We're concerned about that shortage of personal protective equipment and supplies, about ventilators as well. But we're also concerned, nurses are also concerned about the safety of the people and the patients that they're caring for. So it's both ways on that worry about safety. And really encouraged her yet again that where clinical equipment decisions must be made in these very, very uncertain times, that we really urge all governments and all organizations to operate from the assumption that all parties will err on the side of overprotecting rather than underprotection, especially of healthcare workers, healthcare providers, but also of the patients. And also that nurses are well prepared to make those kinds of decisions about their own risk and the risk to the patient, and to choose the personal protective equipment based on sound information and evidence-informed guidelines. And I know Madeleine will speak to that. The minister really reinforced to me and to the Canadian Nurses Association that her office and the federal government are using and exploring every measure, and I think she used every lever that they have available to them, or that they are even innovatively and creatively thinking about, to acquire and distribute the personal protective equipment and the supplies and other critical medical equipment. So over the last few days, the Canadian Nurses Association has developed our key messages on personal protective equipment and highlighted some of the ethical challenges that we know nurses are facing. And within that document, and it'll be available on our website, I'm just going to show a printed copy of it. And I think they'll put the link into the chat box. It also shows an informational table which highlights the varying guidance from both national and international groups, where it exists, where it doesn't exist, and what that guidance is. This was developed, as I said earlier this week, and it will be available on our website. One of the things that was an interesting piece of my conversation with the minister this week is that she said that, you know, it's really only a little over 3.5 months, maybe 4 months ago, that this coronavirus, this novel coronavirus appeared and has spread so rapidly around the world. And the significance of that is really that the evidence and science on that novel virus really continues to change, continues to move just as fast as that spread really is doing. And she expressed that as new evidence and as new research and new information comes to light, that her government, the federal government, is also adapting and changing processes and having to rely on that expertise of the Public Health Agency of Canada. And they're not working really in a vortex was the word that she used, but working in concert and in collaboration with others globally and with their provinces and territories within Canada. And always to support healthcare workers and, of course, all of us living in Canada. So these really are uncharted waters for all of us and our health system and providers, and I know for our families and our communities and for ourselves as individuals. And so that notion of collaboration and working together and standing really in solidarity, I think at no other time is it more important than that. So I think staying informed and staying in tune. So we're really happy to have these opportunities through this conversation series to talk to you. Okay, so I'd really like now to call on our experts, and I'd like to pose some questions. And these questions, I want you to know, were crafted from the feedback that you gave us last week, that you typed into the chat box and that you asked in the Q&A. So I'm going to ask Madeleine first. And Madeleine, given your expertise and your experience, but also given what you're really facing right here today, because you're kind of in the thick of it as an expert in your work, but also in your work within a professional association and an expert organization. What do you recommend, Madeleine, when we are seeing and hearing about so much diversity in what is evidence-based best practice for personal protective equipment for frontline workers in the healthcare setting? And what do we know now about the appropriate personal protective equipment? So over to you, Madeleine, for some comments and some context setting. Thank you.
Thank you, Claire. I'm delighted to be able to participate today. I think this is a very important question because it's hard for us to trust when we're hearing different things as new evidence is coming out every day, and then recommendations are changing in response to those new pieces of evidence. And sometimes facilities are actually creating their own practices and protocols in response to urgent needs that they identify in advance of any official government guidance. So that leads to, I guess, increased confusion and concern. As we know, healthcare is a provincial responsibility. So while the Public Health Agency of Canada does provide some great overall guidance, you'll still find variations between provincial and territorial recommendations. You'll see this, for example, when you look for aerosol generating medical procedures. If you look for what are those on various provincial websites, you'll see quite an array. Another challenge, I think, too, is when you go from higher levels of personal protective equipment to lower levels. And We know that we've been doing this differently across the country. With a new pathogen like COVID-19, Ontario applied the precautionary principle, for example, and initially recommended the use of N95 masks or N95 respirators. And this was contrary to Public Health Agency of Canada and World Health Organization recommendations, but was in line with what CDC was saying. And I believe was in part driven by nursing organizations in Ontario that had pressed for N95 masks during SARS in the Toronto area, and the need for nurses to feel as safe as possible. But once we got more information about the mode of transmission, we found that experts, particularly in hospitals, were saying, we're burning through our N95 masks and we're not going to have enough. Please revisit the PPE required because this is droplet contact transmission. So the Ontario Ministry of Health asked Public Health Ontario to gather the science for this and then provided a directive to use droplet contact precautions with a surgical or procedure mask, except for aerosol generating medical procedures. So this was based on, as I said, scientific information compiled by a PHO, including reviews of all publications. And I'm just doing a little promotion there. If you look on the Public Health Ontario website, we do have something called What We Know So Far, and some reviews of literature that help to inform the decisions that certainly are being made by the Ontario government. And you'll probably find similar things. I know, there's BC CDC has their own great advice and great organization there, and different ones across the country. But I'm particularly focusing right now on that for Ontario because Ontario was the only place where N95s were initially recommended. Now, in light of mask shortages, facilities are now having healthcare workers extend the use of masks, and some are having them reuse them over the course of a shift, and others are gathering used masks for potential reprocessing. And at first I was quite horrified because this is not what we consider best practice in normal conditions. It's single use, take them off, discard, and clean your hands and so on. But these are not ordinary times. These are extraordinary times. And we now really have to focus on mitigating risks and doing the best we can with what we have and making sure we consider the science to assess the risk. I'd also just like to add here that we should always be doing a point of care risk assessment with every encounter we have with our patient, client, resident at all times, not just for COVID-19, but all the time. We should be considering what is the risk of contact with body fluids or contaminated surfaces. For example, to our hands, do we need to wear gloves? To our faces, do we need mask and eye protection? To our clothing or arms, do we need a gown? And the point of care risk assessment depends not just on what you're doing as a healthcare provider. Are you going to do something that's going to make the patient cough or sneeze, like a nasal swab or something? But also how skilled you are at doing it. And then along with what the patient is doing. Is the patient already coughing, sneezing, being uncooperative? And of course, if he or she is known to have or suspected of having a communicable disease. So I think that's a very important factor that needs to be considered at all times, not just in COVID. And just wanted to throw in here too also that the Occupational Health and Safety Act supersedes even emergency measures, that staff need to be protected and they do have the right to refuse to work in circumstances, as the Ontario version of the Act says, where health and safety are in danger. So I think it's really important that we have some tips at the end, but I think it's important that we do focus on our basic routine practice and additional precautions, hand hygiene, physical or social distancing of 6 feet or 2 meters, but also the use of PPE. We make our risk assessment and we consider the science. That's my short answer.
Yeah, thank you. Thank you so much, Madeleine. And I just saw a question and I'm just going to read it and you can think about it when I go over here to Jennifer. And the question is around protecting people who are living in long-term care facilities and actually nurses using protection. I'll come back in a minute and maybe have you ask that one because I've heard that question a number of times. Before I go to Jennifer, I just want to really kind of give a shout out to the Canadian Federation of Nursing Unions and all of those nursing unions that are really working tirelessly, really in strong advocacy on behalf of nurses, and they're doing some tremendous work. And I also wanted to point out that we wrote a letter, the Canadian Nurses Association wrote a joint letter with the Canadian Federation of Nurses Unions to the minister, really advocating for many of the things that I just said earlier. So we are working as much as we can in a really busy time in collaboration and in solidarity with our union colleagues, and we really do appreciate the work that they're doing alongside of us, like really of us as nurses in Canada. So Jennifer, we received a number of questions last week in the chat box and in the Q&A related to difficult ethical decisions or ethical dilemmas, really, that nurses are facing as they are concerned about their own safety. So my question to you, or our question to you, is how can nurses be supported in balancing, and Madeleine kind of hinted at that, they're balancing duty to care and personal safety. So I know that's not an easy question, but as an ethicist and as somebody who's got ethical expertise, perhaps you could give us some of your thoughts on that. Thanks, Jennifer.
Thanks. Yes, these are really difficult dilemmas, because there can be times when you are actually, when your duty to care and your personal safety are truly incompatible. You can't have both at the same time. And so that puts people, especially direct care providers, nurses specifically, into some positions where they really have to make a decision about, do I provide that care or do I keep myself safe? And no matter what the decision is and the process that you use to make it, it's going to be something that keeps you awake at night. So no matter where you kind of fall on the decision. So a few things that I've been thinking about in this context is in situations where you have some PPE and maybe not what you think of as enough, or where you're worried about whether the recommendations are sufficient, we need to think about a few different things. So first of all, with respect to duty to care, you need to think about and recognize the fact that there are many people working furiously behind the scenes to make sure that you have what you need to provide safe care, and to provide care that's safe for you and for your family that you're going home to, and for the patients. So the people that are making decisions, the people that are trying to find and have enough PPE in place, are using the science, using the experts to figure out what we need, and then doing the best that they can to get enough so that we don't have to compromise safety by doing things like reusing when it's not appropriate and that kind of thing. We also need to advocate for ourselves and for our colleagues and for our patients in situations where there are true risks, and maybe some of those risks aren't being recognized, or you don't feel they're being recognized. But we can also do things to mitigate some of those risks, like support innovation. So I've heard of some very creative nurses using long IV tubing and having their pumps outside the door so they don't have to go in and out quite as often. Things like team nursing, so that you can use the equipment that you have efficiently and effectively. Virtual visits are a hot topic these days. So doing things differently and thinking really carefully about exactly what we need to do in these extraordinary times, and what can be done differently, what can be deferred, what we can maybe stretch the intervals on, and that kind of thing. Another thing to think about when we're looking at our duty to care and how to meet that duty is prioritizing. As nurses, we're experts at reshuffling and constantly analyzing and sorting out what the priorities are, and then communicating with our team, our colleagues, our patients, our clients, and their families about what we're seeing, how we're identifying those priorities, and then what we're going to do about them, and making collaborative plans to get that done. And we need to think, when we're thinking about our duty of care, of exactly what we can do. So doing what we can, because there might be a time when everything is upside down, when everything you've always done is completely different. We have different ratios, we have different tasks, we're delegating to people we wouldn't normally delegate to, we're finding innovative ways of providing care. So in these situations, we need to work to our full scope, and we need to lead. We need to be leaders in the healthcare system so that we use our expertise and our scope to get the work done in the safest way possible. And then on the other side of things, when we're staying safe, we need to still support each other to always use the PPE that we have appropriately and according to the science. So we need to balance our fears and anxieties against stewardship of resources, but we can support each other in careful donning and doffing, having somebody watch to make sure that we're doing it correctly, that we haven't made a mistake in it, cleaning reusable items, doing laundry the way that the experts are telling us to do that. So there are lots of ways that we can stay safe that way. We also need to think about taking care of ourselves. So doing what you can to prevent burnout, taking the breaks when you can, balancing your home time, those kinds of things. And then using technology. We were very sad to have to cancel our family's Sunday Easter dinner this week. But we will use probably FaceTime or something like that to at least all have our households in touch over that time. So if you're isolated, if you're working long hours, use those things that we almost all of us now have in our pockets to FaceTime with your family and to stay in touch so that you don't lose touch with each other. And then leveraging help and support, making sure that if somebody's offered to pick up groceries for you, you can stay home and isolated. You don't have to run out and do those errands. Do what use the resources that you have so that when you're not working, if you need contactless delivery services, I've been getting some pretty adventurous in meals from what we have in the pantry and that kind of thing, so we don't have to go to the store. So all of those things are good ways of staying safe and balancing some of those risks when they exist. But in general, I think the bottom line for this is that as nurses, we can support each other. As nurse leaders, as nurses in administrative and leadership positions, we can support each other, and nurses in working on teams in direct care situations, we can really support each other to do the best we can in extraordinary times and keep each other and our patients, our clients, our residents as safe as they can be, hopefully without compromising our own safety. That's kind of what I had to say for that. Back to you, Claire.
Okay, thank you. I'm going to go over to Madeleine for that question that came in around the long-term care facilities and really around, I think, protecting those very vulnerable people. And we've seen some really serious situations. But while Madeleine's answering, Jennifer, I'm going to ask you to think about, somebody just typed in here and said, could you be just a little bit more specific from an ethical perspective about that refusal? Sort of that dilemma where you feel you are unsafe. Just if you could be a little bit more specific, right from that sort of ethical framework, while Madeleine's answering the question around the long-term care, personal care, I'm thinking hospice, home care, those kinds of settings. Not always what we're thinking about. And I certainly reminded the minister that, think about nursing everywhere, not just in some of what we're seeing on the media images in those very critical care, acute care settings. So Madeleine, what's your advice around that, like in terms of long-term care?
Thanks, Claire. Well, I think that, long-term care is a special situation based on the number of high-risk residents, the elderly, comorbidities, they're sitting ducks really for whatever comes into them. I'd like to also just clarify something that I had, said, and I noticed Linda had made a comment. But in regards to access to PPE, when we're talking about risk assessment, point of care risk assessment, it is important that nurses and other healthcare providers have access to the PPE that they believe they need based on their risk assessment and also based on what the science is saying too. But if they have a strong desire for a particular piece of equipment, I think you'd be hard pressed to be supported in saying, oh no, we don't have any. And I think that is a real challenge with the view to maybe not having anything. But I think that it's really important for us to become as knowledgeable as possible and to feel safe and feel confident in our risk assessments. So based on that, now in Ontario today, we had a directive that all staff in long-term care homes will wear a mask, and that's effective today. And this is particularly for source control. So we know, I don't know exactly the number of outbreaks, but I know at the end of last week, we had 41 outbreaks in long-term care homes in Ontario. Some of them are absolutely massive with really bad death rates. And you know, I know some of these homes, and I know some of the ICPs who work there, and you know, are in charge of trying to not only prevent this but now control it, and it's absolutely tragic. So the idea of source control is that it's similar to what is being said now about wearing a mask in public, that while it will not necessarily protect you, it will protect others if you have symptoms or you're pre-symptomatic. So maybe you have the virus in the back of your throat and you happen to cough and not into your sleeve or whatever, or you know, looks like maybe singing can release some viruses and things too. So, you know, or talking, you know, if you're a person who talks forcefully in particular. So, you know, we're just getting some science on this at the moment. It's not confirmed, but let's be on the safe side. Let's have staff in long-term care wearing masks in the clinical setting, so that they are not bringing, they're protecting, you know, their colleagues as well as their residents from whatever they may be brewing themselves. Obviously, if they have symptoms, they shouldn't be on site. But you know, at one home I recall there were right away 70 staff rather who were exposed right from the start. You can't possibly have 70 staff off in a long-term care home. So those who had no symptoms, everyone had to self-monitor, and those who had no symptoms came into work with a mask, and now that seems to be helping. So we're looking at the masking for source control and the access to PPE that they need whenever they're providing care for the individual residents.
Yeah. Okay. Thank you, Madeleine. And I know that also poses a very different way of working within those more home-like settings, right? Where we are really consider those people who live with us and in those residents. And so that's a different way of working. And some of those nurses may not have the skills, certainly in terms of donning and doffing that equipment. So maybe we could even get some resources for some of those nurses that in terms of how to do that. There's some excellent videos out there and excellent things out there. Okay, Jennifer, back to you for that tough question I asked you there from the readers. And then Aden, I'm going to go over to you. Okay, Jennifer.
Well, all the questions in ethics are tough. Otherwise, they wouldn't be ethics. But yeah, I do have a few thoughts on that very specific decision on whether or when to refuse to go to work. And the first thing I would suggest is to get your hands on the ethical decision-making framework or guide that your organization or your area uses to help you think through the situation, because every situation is going to be different. You might be thinking about a particular patient encounter, you might be thinking about a shift, or whether you're going to refuse to work in a particular environment or facility. But those decision-making tools will help you think through that situation to make sure you haven't forgotten any important considerations. You also need to really know your own values and what's important to you and what's important to your family, to the people that you're caring for. So know if you have a particular line in the sand, you know, I can do this much, but no more. Know where that is and make sure that you've communicated that as well as possible so that it doesn't come as a surprise when you're in a position where you're going to have to, when you feel strongly that you'll have to we also need to recognize that what might be right for you or for one situation could be very different from another situation or from another nurse, another colleague. And so you may be more comfortable, you may have a higher or a lower risk tolerance than somebody else, and that's fine. We just need to be able to understand what's important to ourselves, so our own values, so that we can articulate those things and explain them at the time. What I would say is if you are not feeling safe and you are considering refusing to work or refusing to provide care, you need to think about providing as much care as you can while still feeling safe. So finding alternate ways to do that, maintaining a distance, doing things visually or with technology, whatever way you can provide as much care as you can without compromising your own safety. As Madeleine just said, we need to do really thorough risk assessments and truly understand what the risks are. And recognizing that this is a new virus, we don't really know, relatively speaking, a whole lot about it. And so how do we know that what is true and scientific one day is not going to change dramatically the next? We don't, and I think we've seen that throughout this, but do as much of a risk assessment as we can. We also have to maximize our benefits and minimize the harm. So as much as we can possibly balance those risks and those benefits, or those potential risks and potential benefits, we have to do that. So we need a continual reassessment process of how we're thinking, how we're feeling, what's happening in the context and in the situation, and then do what you can. We'll also need to prepare to have some really difficult conversations with our colleagues, with our managers, with our organizations, and certainly with the patients and families, because if this gets as bad and as desperate as we're preparing for and hoping not to have to deal with, we are going to have to support each other for some difficult conversations, and recognize that there will be some situations that we just cannot possibly solve in a way that's good. And so then we'll have to think about how to manage the moral distress that comes along with those decisions that just don't end up feeling very good at all. And so this is a balancing act, but it's something that we'll have to do on a situation by situation basis, and think really hard about how we do that, and then how we do what we can, even if we don't feel like we can do maybe what our traditional roles would be. So lots and lots of things to think about, and these are never going to be easy answers, but there will be ways when we collaborate, I think, to do as much as we can.
Thank you. And for those of you who are watching the chat box, and I really appreciate her being here, Linda Silas, the President and CEO of the Canadian Federation of Nurses Unions, is on the chat box and has just actually typed in Jennifer I think some really good advice, which was also, of course, if you belong, contact your union. I mean, they're there to talk to, they're there to talk with you through those situations, they're there to support your teams. And so not to forget about have available to us. And she says that nurses don't abandon their patients, and I would agree with her on that. But you do need to be safe, and you also need to make sure that you're not posing a risk to those that you're caring for. So thank you. Jennifer, we're kind of moving along here. We planned for 45 minutes. We didn't want to have long conversations, respecting the busyness that everybody is out there. Aden, I'm going to ask you to put up a poll, and I'm going to ask you to introduce the poll just as you're putting it up. And then I think I'm going to come back to maybe just one really quick question, because I'd like to hear some summary comments from Madeleine and Jennifer. So Aden, can you put that poll up for us, please?
Yeah, absolutely. So as you may have seen in the media and in public briefings, there's been a significant amount of discussion around potential options for the decontamination and sterilization of used masks in critical situations. And part of our role is to make sure we're making policy and advocating on behalf of nurses through an informed lens, informed by you, our nurses, our members. And so we really appreciate getting your feedback on what your thoughts are in terms of the most important considerations for nurses if you were to have to reuse N95 respirators that have been decontaminated or sterilized, because we do think that your feedback will help inform our work and our advocacy efforts immensely.
Okay, thanks so much, Aden. So I think everyone can see that poll in front of you. So you're all welcome to put that in there. So Aden, could you just pick one question that you think we could answer? Got about 6 minutes left here, fairly quickly, in terms of, I kind of picked a few as we were going there. Is there one that you're seeing? I haven't watched the Q&A.
There was one actually related to our role as educators and supports for patients and families, which I think might be helpful here. The question is related to what are the best practices to support nurses and professionals who are working with patients and families during this time and wanting to continue to support their loved ones, but also continue to support their patients who may experiencing social isolation or difficulty with social distancing.
Okay, so I'm going to put you on the spot to be quick here. I'm going to start with you, Jennifer, and then go over to Madeleine, and then I'm going to ask you for your best advice. So just maybe a quick answer or a point to a resource would be great. So Jennifer?
I think for me, our health region, our province, is doing a really great job of providing resources in all kinds of different formats, video, written, multiple languages. So I think checking with some of that, because they're being constantly updated, and we've had a lot of really good evolution of some of those documents. So my suggestion is to have a look. I mean, I'm thinking especially of things like our mental health resources here in Manitoba. We've got all kinds of good supports for people, for families, for people who are in isolation or who are really struggling with the social piece of things. So I would say check your jurisdiction's evidence page or public support page, public information page for those kinds of resources, because they will be the state. Don't rely on Facebook, please.
Hi,
Claire.
sorry.
Go ahead, Matt.
Yes, hi. So I do agree with Jennifer. I think these are all important things. And I think that, you know, education is so important. I've seen in the chat box people saying that people don't know how to put their PPE on, they're not trained. I think this is actually quite horrifying, but it is the responsibility of employers as well as the employee to have the proper training when they're doing anything specifically, I think, you know, for infection prevention control, because I've been doing that for 20 years now. But I think that you don't need to reinvent things. There are wonderful resources out there, and I think that's a key message. Like what I've seen is everybody wants to help, so everybody's developing their own stuff. And please don't duplicate effort and reinvent the wheel. We have wonderful resources. CNA has lists of good places to go to get the resources. There's modules, there's education. We have Public Health Ontario, for example, has learning modules that are free. Anyone can do them online. IPAC Canada has all kinds of great resources as well. Don't, you know, go and look at some of these things rather than, you know, feeling obliged to create your own. And as Jennifer said, our you know, ministries of health, our provincial websites, as well as Public Health Agency of Canada also has great stuff. So have a look first instead of thinking, I'm going to develop one just for our folks, because there are other probably more valuable things you could be doing with your time to support your colleagues.
Okay, so I was going to ask you for your best advice. That was great advice. I'm just going to ask you, maybe stay with you, Madeleine.
Okay, sure.
Just 1 second though, Aden, I'm going to ask you to put up that poll on future topics. I think while Madeleine's giving her tips, we can just maybe take a look at those future topics. Madeleine, do you have another tip? And then Jennifer, I'm going to go over to you for your best advice, because that was a great.
Okay. Thank you. Well, I have 3 quick tips. The first one I would say is to protect yourself. So continue to reinforce that with yourself and the people you know and care for and care about. The 2-meter distancing, the hand hygiene, so critically important. Probably all this more important than the PPE, really, right? But the PPE, don't forget eye protection. We're all so focused on the mask. What about your eyes? You don't have much to prevent organisms getting in your eyes. So eye protection is critical. And question the PPE. If you have concerns about the PPE you're being given or the processes that you're having to follow, please ask why. Where's the evidence for this? How do I know this is being properly reprocessed? Or why am I given one mask to wear for the day? And you know, ask those questions, because everybody needs to have the answers. There is science to support some of these, and we need to bring that forward, and people need to know, not just because you have to wear it to work here. Please provide me with the evidence that supports this decision. Another thing, quickly, use reliable sources of info. I mentioned that before. Public Health Agency of Canada, World Health, your provincial ministries of health, your local public health unit, and of course CNA. Be kind to each other. Finally, everyone is stressed, and you're doing amazing work in your fields across Canada in this International Year of the Nurse and Midwife. Who knew it would go this way? But you know, we're all stressed, and we might get snappy, and we might say things we don't mean. And let's understand each other and support each other in that way. Thanks.
Thanks. My mother would agree with you on the kindness part. Be kind. Thank you. And kind to yourself first, right? Thanks, Madeleine, for those tips. Those are excellent. Jennifer.
My first thought is put on your own mask first, literally and figuratively. So if you're really struggling with some of the decisions that we've had to make, and you've got some moral distress about some of this, one of the most important things to do is to take care of yourself first. You can't serve from an empty bowl, I think is another way of putting it. So work-life balance. I know we work long hours and we have really important, heavy things on our minds, but nutrition, sleep, exercise, enjoyment, spending time with your family, that kind of thing. I would suggest identifying your resources. So your backup plans, ethics experts, ethical decision-making guides, all of those kinds of things that can help you when you have a decision to make. Do what you can and let go what you can't, and that's always easier said than done. But when there's one of those really awful situations that you've had to live through, recognize when there is nothing that you could have done about it and try and let it go. And you may need support, outside support, debriefing, support from your colleagues or from EAP, from counseling and that kind of thing. Escalate when you have to. So if there's something that you're really concerned about, if you're seeing a break between the evidence and what you're being provided or what you're being asked to do, escalate your concerns. And then use those concerns as a springboard for action. So advocate for debriefing, for improvement activities, for change in policy when that needs to happen. And then again, just make sure that we're supporting each other. And I really do agree with the being kind. We're all in this together, and so let's support each other and let's get through it together in the best way we can.
In the best way that we can. Thank you so much, Jennifer, and thank you so much, Madeleine. Elizabeth, I'm going to ask you to put that final poll. Thank you for the answer to the other poll. I'm going to ask Elizabeth, it's just about your likeliness to use what you've heard here today. So I'm going to ask Elizabeth to put that up. So I just really want to thank you, Jennifer, fellow Manitoban and board member of CNA and president of the Association of Registered Nurses of Manitoba. Madeleine, thank you for being such a solid expert there in Ontario and for also being part of our board, CNA. It was a delight to serve with you for those years that we did. And thank you so much for being here today and for being such great experts and such great participants in this conversation. And then finally, thank you to all the people. There was more than 250 of you that came today and gave us your time. You've asked many good questions. I promise you they will not be lost. We will do our best to answer them in other formats and in other ways and to collate them. And I just want to say that we're having another conversation or coffee with Claire next Friday, same time, but Friday because tomorrow's a holiday. Of course, it's Good Friday. And it'll be focusing on mental health, and we have some incredible experts going to be with us next week for that conversation. So please consider coming back. There's also another webinar, CNA webinar on April 23rd with the Community Health Nurses of Canada, also focusing on COVID. So Elizabeth, I'm looking for that final panel before we sign, final poll before we sign off.
The poll is up.
Oh, okay, I just can't see it. Okay, so we're gonna leave, we're gonna adjourn or finish our conversation here today by thanking everybody. We'll leave it open so you can actually type in a little bit as you go. Okay, so thank you, Madeleine. Thank you, Jennifer. Thank you, everybody. See you next week. Bye now.
Bye. Thank you.
Bye-bye.
I don't know why it's not showing. Okay, so we had some technical issues with the last poll. For some reason, it wouldn't show up even though the first two did. So I'm not sure why that was. We'll have to see if we can figure that out.
Okay, thank you, Elizabeth, for the update, and maybe that's something that we can put out in the post-webinar email blast as well.
Yeah, I can do a separate poll using our survey software.
Perfect. Thank
Yeah.
you, everyone, for attending, and apologies for the technical difficulties, but we'll make sure we get that question out to you. Take care, everyone.
Bye-bye.